Sister Jones. How are you doing today?
Hi, I'm just doing peachy today. How are you?
Good. Well, my name is Natalie Reynolds. I'm going to be your occupational therapist today.
Okay.
I see that you have had, you experienced a right middle cerebral artery infarction that caused you to have a coronary artery bypass graft called a CABG. Is this correct?
Yes.
All right. So during your CABG surgery, you suffered a right CDA or right stroke that affected your left upper extremity hemiparesis. Is this correct?
Yes.
Okay. So the doctors ordered me to do an evaluation on you today. This will help me better get an understanding of your symptoms, your problems, anything that you want to get back to doing.
Okay.
So does this sound like something you want to do?
Yeah, that sounds good.
Good. All right, it says here in your past medical history that you've had high blood pressure, arthritis, and had your tonsils removed.
Yes, I have.
All right. And then it also says that you're having problems swallowing, and you're on nectar or thick liquids.
Yeah, I'm just having all kinds of problems.
Oh no, I'm sorry about that.
It's alright.
All right, well, have you been told your sternal and your hypotension precautions?
I have been told these precautions 1,000,000 times.
Well, then, can you tell me them?
Yeah, I can actually. So, for my sternal precautions, I don't want to move my arms too far away from my body.
Mm-hmm.
So when I'm getting up or transferring, just keep them nice and close. I also want to use this pillow, hold it real tight to me so that I don't mess up my incision.
Right.
And then if I'm like coughing or doing my breathing exercises as well. And then also, I don't want to lift more than like 5 pounds.
Mm-hmm.
And then I don't want to have people tugging on me and
Right.
pushing on me, on my
Right.
arms.
Right, so no pushing or pulling, so even when you're getting off the bed, you can't push off the bed.
Right, okay.
And then, do you know your low blood pressure precautions also?
Yes.
All right.
So with that, so if I've been laying down for too long, I just kind of want to get up nice and slowly.
Good.
Because I don't want my blood pressure to drop, and then I might get like dizzy or, pass out. Yeah, what happened?
We definitely don't want that.
So I just kind of, take breaks.
Okay.
When I'm doing that, getting up.
All right. So it says here that you're going to be living at home with your wife,
Mhm.
and you have a dog.
Yeah, we do. It's
Aw.
a little golden retriever.
Aww.
Yeah.
So it must be a puppy, though, right?
Yeah, just a little.
All right. And then also says that you live on the first floor of your condo.
Yes.
Okay. So is your wife going to be at home, or is she going to be at work most of the time?
She's actually retired, so
Okay.
she'll be home with me. She should be able to help me with a lot of things.
Good.
So that'll be good.
Okay. I also need to know, when you enter your condo, does it have a step or is there no steps?
There's one little tiny step to get into the house.
Okay. All right. That's good to know so we can work on that.
Yes.
Also, is your wife able to perform the tasks that you used to perform?
Yeah, like I said, I do a lot of things. I did a lot of things.
Okay.
But she's pretty healthy, so she should be
Right.
able to take on a lot of that.
Good. Good. I'm glad to hear that.
Yeah.
It's always good to have a supportive wife.
Mhm. Oh yeah.
All right. So now that I have a better understanding of your past history, I want to see a few more things. So, are you experiencing any more pain today?
Yeah, I'm actually having a little bit of chest discomfort. I guess maybe from my surgery.
Okay. Is it just your incision or is it more heart related?
I think it's just from my stitches.
Okay. Okay.
Yeah.
Well, that's normal
Mhm.
because you just had your surgery, so you're gonna be
Right.
getting over that.
Okay.
Are you taking any medications for
Mhm.
pain and stuff?
Yeah.
Have you had them?
Yeah. The nurse came in this morning.
Good. Good. I'm glad to hear that. So So now what I want to do is I want to get you up. I want to get you in this wheelchair that I'm sitting in.
Okay.
And I want to do a few activities with you to see your functional movement and
That
stuff.
sounds good.
All right. So I'm going to move this wheelchair out of the way
Okay.
for the time being. And then I want to see how much you can do.
Alrighty.
So let's see what you do first.
I got my pillow ready.
Good. All right.
Okay, let's go. Alright.
Alright, so now I'm gonna put the gate bed on you just for safety.
Okay.
We don't know how you're doing after surgery.
Never had to use one of these before.
Well, we just like to use them just for safety precautions.
Mm-hmm.
They help us have a better grip on you.
Okay.
Okay. Alright, so I'm gonna be here. Oh wait, let me move your wheelchair closer to you.
Okay.
Alright, so
Yeah,
let's get
this
your
pillow again.
pillow. Alright, so are you feeling dizzy or anything?
No, I'm ready to go.
Alright, so let me. Alright, so I want to see how much you can do.
Alrighty.
Okay.
Scoot forward a little bit.
Okay. Good.
Alright. Okay.
Ready when you are.
Okay, let's.
Alright. Ooh, I see you're a little wobbly today.
Yeah.
Alright, well, let's put it to the chair.
Okay.
Alright. So you feel the back of the chair on your legs?
Mm-hmm.
Alright, I want you to sit down slowly.
Okay.
Alright, good job.
Thank you.
Alright, I'm going to move this for you.
Okay.
Alright, so it seems that you're able to move a lot, so I see that you can like roll and you can sit up
Yeah.
easily.
Mm-hmm.
I do see that you are wobbly, so I think we're gonna want a little Hemi walker to help you.
Okay, that sounds good.
Alright. So now that we have you sitting here, I want to see how well you can put on this t-shirt. But I'm gonna let you do it first, see how you do.
Okay. Never had to do it with one arm before, so
That's okay,
We'll
that's what
see
we're here
how-
for.
see how it goes.
Oh, wait, let me show you one of our tricks.
Okay.
Alright, so when you have it laying right here, I
Okay.
want you to roll it up with your hand, roll it up in the back. Yeah, like that. And then I want you to put your affected side in first.
Okay.
I'll make it much easier.
Oh, that is a lot easier.
Yeah. Then you can put your good arm in. Good. Very good. Might have to take your hat off.
Oh, we'll see.
Oh, that was very good.
Ta-da!
I'm impressed.
Thank you.
All right, that's really good.
Thank you.
I see that you have a lot of movement. So I want to see how well you can put some deodorant on. You don't have to take the cap off. I just want to see your movement.
Okay.
Okay? There you go.
Sounds a little hard.
Yeah, that's normal, but we'll work on that, and I'll show you some tips for that later on.
Okay.
Now I want to see your range of motion by putting on socks. So let's see how well you can do that. Okay. Can you bring your leg up to you?
Yeah.
Okay. Oh, very good. I like seeing you try to incorporate your left hand.
Thank you. Get away from me. There we go.
Good. That was very good.
Thank you.
So, I see that you're able to lift your hands, so when you put your shirt over your head, so you're able to bathe, you're able to brush your teeth, so you're able to get down to your feet for dressing, which is very good. So this is when we would normally do a manual muscle test, but since you have sternal precautions of no lifting, pulling, or pushing, that would be against your precautions. So
Right. Okay.
we're not going to do that.
Okay.
So now we're going to see about your IADLs, your instrumental activities of daily living.
Okay.
So those would be like your cooking, you're taking care of your dogs, you're building airplanes, I see.
Yeah, I'm a model airplane.
That's awesome.
Yeah.
Alright, so do you do much of the grocery shopping or does your wife?
Before everything, I did a lot of stuff,
Mhm.
but I don't know if I could do it right now.
Okay.
My wife would probably have to do a lot of it.
Okay, that's okay. Do you have a pill organizer or?
No, I didn't really have to take many pills before this either, so,
Okay. Well, I just want to see if you can open this pill box for me.
Okay. I don't know if I'll be able to.
That's okay. I just need to see about your fine motor. Mainly on your left side, but okay.
It's a little tricky, but
Alright, well that's good. We can work on that. Very good.
thank you.
Okay. So. Alright, so that gives me a better understanding of those things.
Okay, cool.
Alright, so now, can you see the clock on the wall up there?
Yeah, a little bit. Not too much.
Can you tell me what time it is?
No, I can't see it.
Okay, that's fine. So I can tell that you have a little left side neglect.
Yeah.
I just want to see something real quick. So,
Okay.
tell me when you can't see my finger.
I can't see it.
Okay? What about this side?
I can't see it now.
Alright, so definitely some left side neglect there. Yes. Alright, so we can work on that. So now I want to talk about your goals, Mr. Jones.
Okay.
We want to start working on strengthening your upper body, especially on the weak side,
Okay.
because it does tend to get neglected a lot of the times.
Yeah.
So we're going to be doing a lot of therapeutic exercises like using the TheraBands to strengthen it. We also want to work on strengthening your balance, so your core, so we might have you on like a ball.
Okay.
So we also want to incorporate some fine motor skills with this hand.
Okay.
So
Yeah, so I can go back to work as an electrician.
exactly. Another goal we want to work on is your endurance for performing your ADLs, like your bathing, your dressing.
Okay.
We also want to work on like IADL, so like your grocery shopping, your walking your dog. We want to help prevent your shortness of breath.
Okay.
Okay. So do all these sound like things that you would want to do?
Sounds good.
Good. All right. So now I'm going to give you a little bit of homework.
Okay.
I'm going to give you this silly putty, and I want you to put it in your left hand, and I want you to really squeeze it and lay it flat on the table and work on pushing down with that.
Okay.
This will help with your fine motor.
Okay. I think I can do that.
Good. And then I also want to help incorporate your wife in this. So when she's talking to you, she can talk to your left side. So it'll help you work on your left side and look to her.
Okay.
I also want to inform the nurses that we're trying to incorporate your left arm. So if they beat me to dressing you in the mornings, I want them to let you do as much as possible.
Okay.
I also understand that you haven't been able to go to the bathroom in a couple of days.
No, not for a few days.
Okay. So I want to talk to them again about getting you a bedside commode just in case.
Okay, that sounds good.
Okay. And then discharge, which I know you're happy to hear.
Yeah, I can't wait for that.
So, I want to start you out on a Hemi walker,
Okay.
and then later down the road you'll probably progress to like a cane or something like
Yeah.
that.
Okay.
Now is your bathtub, is it step over or is it walk in?
It's a step over bathtub.
Okay, so I want to suggest you getting a bath chair so that you can get into your bathtub.
Okay.
Easier in so we can help prevent any slips or anything like that. We don't want any accidents.
No, not at all.
I also want to refer you to some speech so that we can try to get rid of your swallowing problem because I know you don't want to be on extra liquids.
No, I'm over that
Yes,
stuff.
I understand. So after we discharge you from our facility, what normally happens is we refer you to like outpatient or even home health if you really want it, but outpatient is probably better for you. It's more.
Yeah, that sounds good. And my wife can drive me there.
Okay, well good.
Mhm.
All right, so do all your goals and everything sound good to you?
Yeah, everything sounds perfect.
Good. Well, I was so happy to meet you.
Thank you.